Hi friends. Now I have the honor and pleasure of having with me Dr. Kapil Bajaj, rank 21 in this PGI Chandigarh exam. Heartiest congratulations. I'm sure people listening to him today will gain a lot from his motivation and what he says about the exam. So Kapil, how are you feeling today?
Sir, waiting for this moment for past 6 months.
Yes.
Worked hard a lot, and thanks a lot to DAMS faculty.
So how are you feeling on the hot seat today?
A bit nervous.
Bit nervous. So now we will not make you nervous. We'll ask you very simple questions today. Very simple questions. So when you gave the PGI exam this year,
Yes, sir.
and when you entered the exam hall, you opened the question paper. What was your feeling?
Well, in the first 15-20 questions, I got the idea ki this is my day. If I haven't done in aims, I'll do in this exam, or not. Even if not in this exam, I'll crack it in November. I had this confidence in myself ki I can do it.
How many choices did you mark? Because this is always a question that out of 1250, how many choices did you mark in this?
520, 540 in between it.
Yes, what I've learned is, and I'm sure you would agree, in this exam, in this time in PGI exam, there were more correct answers than the usual. And I've seen all the rankers have done 550,
yes, sir.
more around 550 is the number that people have marked.
Nearly 560,
570,
yes,
like that. Classically, people mark slightly less. This time people have done maybe little more, but maybe because the number of correct answers were
either
more.
The number of correct answers were more, or we were more confident.
I think the correct answers were more.
You can say that.
And yes, so Kapil, and what when you get a rank like this today, and
Yes,
you're sitting on this hot seat today, you've gotten a rank 21 in a central institute in the country, the one of the best in the country. So what all do you feel today? You want to dedicate, you remember your parents. What do you want to say?
Well, you can see my dimple on the face. I'm sailing the sea of happiness right now.
Yes. You want to, convey by this medium, you want to say something to your parents or something to your family who are listening to you?
Well, one message that I wanted to give my family is thank you for their constant support and believe in me.
Yes.
Even when I started to think give up and join Amritsar when I got surgery in the Amritsar Medical College.
Yes.
Well, my parents told me you have worked hard for 6 months, why not give it another try? So I said okay.
So I always feel the parents have that central contribution to what a man can become is
Yes, sir.
due to the parents. Yes, very nice. So now let's get it from you, from your strategy, that you started with the foundation course.
Yes, sir.
And you started with us in 3rd year, and you were telling me that you were a bit naughty at that time, and you were not actually attending, missing some classes in between here and there, and then you followed it up in internship with the
Yes,
test and discussion.
Well, everyone is naughty at that age. I'm not the exception.
I understand. I understand. I'm just making you less nervous. So I just wanted to know, Kapil, that when you listening to now, when you look back at your preparation graph and how it all went on, do you want to tell people that it is a good idea to start early?
Yes, sir.
Yes, because
it helps a lot.
Because sometimes you need a senior like you to pat the back of the juniors that it is good to be serious.
Well, sometimes
Yes.
it feels good that now your juniors start asking you, sir, how did you do it?
Yes.
We haven't seen you studying a lot
Yes.
in the previous 5 years.
Yes. So
Well, it feels
usually the starting early helps you to like consolidate things and
Well, it helps a lot.
yes. And then you followed it up with the test and discussion.
Test and discussion.
So how was your experience in test and discussion?
Well, test and discussion, my experience was good. First of all, it helped me covering my syllabus in time. So most important thing was that covering my own syllabus, and well, all I've done is DAMS notes in previous year exams for PGI and aims. Well, most of the questions were from DAMS notes, so I haven't studied anything else much more.
So actually, what I also feel is that the central thing is to have notes.
Yes, sir.
Have notes, and another central thing that I feel is the previous papers, especially in exam
Yes,
like
sir. PGI, yes, sir.
where they have a lot of topic repeats. But
Topics and
but overdoing by collecting a lot of guidebooks actually backfires.
Well, that doesn't help.
That backfires. Yes. And that has actually happened is like what has happened in India is that there is no process of peer review. So it has actually become very easy to publish in India, and everybody who starts doing a PG in any subject, he decides that okay, tomorrow I want to write a guide, and for a small subjects also you have 10 guides, 20 guides, students are buying all this, and so what is happening is this is a lack of peer review process in the publishing industry that has contributed to all this. But all said and done, looking at the past paper of any exam that you are sitting for is always the advisable thing, because that gives you an insight into what they are going to do, how they are going to give me the time management thing. So another thing that a lot of people who get a good rank in PGI, they tell me that this is the first time that they are actually sitting for a pen and paper kind of a exam.
Yes, sir.
It is slightly different. So what is the feeling?
Well, sir, it is difficult to complete the exam in 3 hours.
Time is a crunch.
Time is the main issue.
Yeah.
Well, knowledge for first 100 students, knowledge is all the same.
Yes.
And
I
thing that matters is what stress you are at level.
Yes. And on that day.
On that day,
on
what
that
you
day
do.
Any topics, that like, let me take it out from you, any topics that you feel that a student who is aspiring for PGI next
sir.
year, somebody who wants to be in your seat, hot seat next year, any topics that you want to tell him?
So genetics for biochemistry.
Genetics, yes.
Head and neck and neuroanatomy for anatomy.
Yes.
Medicine, rheumat.
Neuroanatomy I've seen is kind of the cross sections and everything in other exams I've also picked up.
So neuroanatomy is one thing that neither we have studied neurophysiology in first year, nor neuroanatomy, nor neuropathology, and medicine. तो आपको पता ही है sir क्या होता है neuro में.
So any idea that you like other than these topics, like any thing that you can you want to convey to the audience and you want to motivate them? What is your mantra of your success? Like if I asked you to summary in one line, that what is Dr. Kapil all about? Why he is successful? Why?
Well, because I studied from one place, that is DAM's notes, and revised it again and again.
That is so kind of you. But what is your personality trait? Like somebody would say hard work, somebody would say intelligence, somebody would say persistence, somebody would say revision. What is your one word about you? Tough question.
Revision a lot.
Revision.
Yes,
so
sir.
he actually believes in doing revision multiple times. And if you listen to him very carefully, what he has actually brought it up to is he had faith in a system that he is following. He made DAM's notes as his basic. He increased his seriousness level by the time he kept going up in the medical college, and by the time he reached TND, he was actually peaking at the right time, and then he religiously followed and gave all the tests. This time he was much more serious than what he was before.
Than the previous one.
Yes, and then he pushed his best effort into the exam.
Yes, sir.
Yes.
Well, I tried my best.
Yes, and on the day of the exam, he felt that this is my day.
Well, sir, on the day of the exam, day before that day, result for AIMS was declared, and
that is very bad timing. That's very bad
when you
timing
see 7 of your batchmates going in top institute in rank 10, and you got 270, well, that is better disheartening.
Yes, I think they could have delayed the result by one day, but every year, one day before the PGI exam, they declare the result. That is like slightly, maybe two top institutes should talk amongst themselves and give a joint result declaration. Why bother the students so much? But I think this is how things work in India. Yeah. You have to be mentally tough. The moral of the story is that you may not get a good rank in AIMS, but don't let that rank affect you so much that you spoil your performance in the next day.
Yes, sir.
So he slept over it.
Well, all I had was my friend's support and my preparation.
Yes, and then he went to the exam, opened the paper, and he knew it was my day, and he.
Well, I came back and then called my father, and then I said कि ये तो आज तो हो जाएगा.
Yes, that is the spirit.
ये paper मेरा है, ये निकल जाएगा.
That is the spirit. I have heard the same line. Sometimes the cricketers also say ये pitch मेरा है. I have seen बोलते हैं ground मेरा है, ये ground मेरा है. Saurav Ganguly will say ये मेरा ground. So very good. I am very happy to meet you, and I am sure people listening to you are also gaining a lot of information. That because if people who are on the other side, they always want to know what goes inside the mind of a person who gets a rank 21 in PGI Chandigarh. That's a big central institute. Everybody is aiming to reach there.
Well, sir, one thing one has to keep in mind is ki study from one place and keep it revising again and again, instead of doing from one thing from here and again doing it from some other book. That doesn't help.
I agree because I feel some people create a hodgepodge. That they're doing something here, and in the end they've nothing.
Then it is difficult to revise, and if you have studied, doesn't make a sense studying it from somewhere else again and again.
Any particular teachers about in DAMS or any particular things about DAMS that you can recall today?
First of all, sir, it is you for the motivation and knowledge that you have provided us. Then Dr. Deepti, because nothing in Obs and Gynae comes out of our notes. मतलब उसी नोट्स वही नोट्स है जिससे आना है सब, उसके बाहर एक शब्द नहीं आता है.
That is so kind of you.
Then Dr. Saurav Jindal, well, dermatology, and Dr. Arvind Kumar for medicine, and Dr. Sachin Arora, psychiatry.
In particular, I would always say Arvind is somebody who's like
he's like, appreciated by everyone.
Like he's just like a flowing Harrison. He'll just take and do everything.
Yes,
but he makes it appear so simple, and so like he's never hassled up. He's very organized teacher. Very organized.
he makes it look like a easy medicine. इतना easy नहीं है जितना सर पढ़ाते हैं जिस हिसाब से.
It's been very, almost 2 decades that he's been teaching with dams, and he's one of the pillars. Any particular thing that we do that you like we do test series, we do TND, we do the grand test have videos in the end, we do the DVT session. Any particular thing that comes to your mind that you feel?
Well, for DVT I'd like to say one thing, ki basics from theory should be clear, ki what the brain doesn't know, the eyes can't see in the image.
Yes.
So theory आना जरूरी है.
Yeah.
इमेज नहीं भी पता हो तो थ्योरी से सवाल निकलेगा.
Especially in exam like PGI, जहाँ पे black and white.
जहाँ तो है ही कुछ है ही नहीं आपके पास.
I know. So actually, I'm very happy to interact with you, and I'm sure people have found a very interesting person. I'm sure you'll get a lot of friend requests after this interview gets over.
Well, already getting.
Already getting. I'm very happy to be with you today, and it's been a pleasure to interview you. On behalf of the entire DAMS family, I wish you all the best. I'm sure you will do well in life. Getting a rank PGI rank 21 is no big deal. He's done. He's achieved so much so today in life, and I'm sure this graph will keep going upwards.
Thank you so much.
I'm sure he'll keep doing well in life. You will hear about him in the future as well as a very famous doctor, a famous surgeon, and I'm sure he will contribute to the society and touch more lives.
Yes.
Thank you very much. We wish him all the best.
Thank you, sir.